this is ultrasound study of 45 years old male. Had removal of the calculi from the right kidney, and then later on the ureter was implanted, stent was placed, and has been removed only 1.5 months back. Now he is having pyuria. That is the only finding and history that I have. What you are seeing is that this is the liver angle, this is the liver, this is the upper pole of the right kidney of this gentleman, and you can see layered out debris. This is all debris, and the dilation of the calyces. The calyces are significantly dilated, and these are all these are all dilated calyces, and this is the tipping sign. This linear structure that you are seeing is the called the tipping sign of massive hydronephrosis. Now you see that hydronephrosis is to the extent that it has compromised the parenchyma of the kidney. The parenchyma measures only 5.7 millimeters, and there is debris within the dilated pelvis of the kidney. Now this is the pelvis of the kidney, in fact. So this is the upper pole, this is the mid region. In this view you are not seeing the lower pole. However, the pelvis, this is the pelvis of the kidney filled with debris, is clearly seen. So now let's see, let me show you on real time. This is what we were seeing, and no blood flow is seen in a region of the parenchyma, and this is the upper pole of the hair. Here, this is the upper pole. Little bit of blood supply is seen, definitely. This is the upper pole, sorry, lower pole of this kidney, right kidney. Then when you see the pelvis is full of debris, and this is the proximal ureter, which measures approximately 15.8, and we know that more than 7 is dilated ureter, so this is a dilated ureter. You see, I can follow this. Now, what is this structure? This tubular structure. Is it a vessel, or it is the continuation of the ureter? Let's follow it. Now, we do not see any blood flow within this tubular structure, so this is in fact the continuation of the ureter, where bowel gases do disturb us. But this is now this area is the pelvis, then the proximal ureter, then this is the ureter further down. This is all ureter, this is ureter. There is debris within the ureter. Now the ureter is dilated up to 11.1 mm in this plan. This is debris within the right ureter, which is seen dilated, and then moving further down here. See, this is the length of the ureter that is traceable. Is this a vessel or is it a ureter? So this is a ureter. We can trace the whole length of the ureter. See, from here to here, it measures 12.0 by 11.7, averaging 11.7. So this is so far as the status of the right ureter is concerned. Okay, now let's see the urinary bladder. पेशाब रुक गया जी कुछ? हाँ जी रुक गया। Okay. Now this is the urinary bladder. In transfer section, down you see the prostate here. This is the prostate. This is the urinary bladder. It's now urinary bladder. There is nothing significant so far as the urinary bladder is concerned. No stone, no debris, nothing. This is the prostate in transfer section. But as I move the probe, now from here, when I will angle the probe towards the right side, you will see a tubular structure again. Here, this, which is appearing as echo-filled tubular structure. This one, filled with echoes. This is the outline of this tubular structure, and this tubular structure is being seen at this is the right wall of the ureter, this is the anterior wall, so at the margin of where the upper and the right wall of the urinary bladder meet, or they should combine, there is a tubular structure which is an implanted ureter. Surgically, there has been surgical intervention in this patient. This is all debris. This is all debris, bleed or pus with this tiny 8.6 mm calcification within it, calcified area within it, which is the cause of back pressure, hydroureter, and massive hydronephrosis of the right kidney. This is the cause, and so anterior wall of the urinary bladder, this is the right lateral wall, and here is the insertion of the implanted ureter, which is filled with echoes, measures at approximately 11.1 mm, with a calculus at its opening into the urinary bladder, measuring 8.6 mm, along with debris, full of debris. So, had there not been any history of surgical intervention, then we would have thought of some fistula or some other pathology. So, this is the urinary bladder, and this is the cause of the all of the pathology that we have seen relating to the right kidney. Now let's see if there is any blood flow within it, or am I making a mistake? When you have a facility of a Doppler, then it should be applied. Now I'm going to apply the Doppler to see if there is any flow within it. We do not see any flow within these tubular structures, and thus this is in fact, again I am going to repeat, this tubular structure is the implanted ureter, and it is full of debris along with tiny calcification at its opening into the urinary bladder, and this is the cause of all the rest of the findings that we saw. I'm going to repeat it for you once again. This is the right kidney. Okay, fine. Pelvis. This is the ureter. This is the ureter. I can trace the whole length of the ureter. This is the ureter, and I can trace it. Would that yes, I can trace it down to the urinary bladder where the ureter has been implanted. And it shows why it's ureter. This is number one. there is history of that. Number 2, and there is no blood flow seen in this tubular structure filled with debris and tiny echogenic calculi, where it opens into the urinary bladder. Here, it opens into the urinary bladder in this region, and see the calculi and debris. This is the tubular structure. So this is the study regarding one aspect of the this right-sided pathology. Now there is another pathology. When I move the probe upwards and when I enter into the region of the right iliac fossa, this is the urinary bladder. This is the urinary bladder. This is the implanted ureter. Okay. Keep these two things in your mind, and then when I move the probe towards the right iliac fossa into the right lower abdominal quadrant, I see a bowel segment with collapsed lumen. Here we are. Now this is the bowel segment with collapsed lumen, which is seen in the region of the right lower abdominal quadrant, and when I trace it at its lower end, you can see that it gives pressure on the implanted ureter. From where this bowel segment starts. This is the actually implanted ureter. This is the implanted ureter. And this is the bowels. This is the bowel that this is the bowel segment giving dirty shadow and downwards. This is the collapsed lumen with gas, and here you see the dirty bowel from it. Dirty shadow from it, and this is the implanted ureter, and this is the urinary bladder. So it is also giving pressure effect. This bowel mass is giving pressure effect on the ureter. Adherent bowels are seen that do not show any movement. Let us first study this bowel segment in the region of the right iliac fossa extending into the right lower abdominal quadrant. Here we are. Let me take this full length. Sorry. Now this is the longitudinal section of this bowel mass, measuring approximately in length. It measures 8.7 centimeters. However, roughly in anterior posterior diameter it measures 2.7 centimeters, and its wall. This is the wall of the bowel segment, measuring 6.8, and more than 5 is considered to be pathological. So this is the bowel gases, collapsed lumen of the bowel with gases, dirty shadow from it. So there is a bowel related mass in the region of the right lower quadrant that extends up to the point of insertion of the now see again if I can relate you. Now here, this is a better view to show you. This is the urinary bladder, this is the implanted ureter, this is the echogenic area or calcification blocking its flow into the urinary bladder, and this is the bowel segment. This is the omentum. Thick omentum is seen around this bowel segment, and this bowel segment is giving pressure effect on the implanted ureter, right ureter. So there are two factors that are the cause of obstructive uropathy, that is hydroureter as well as massive hydronephrosis. One, the blockage of the implanted ureter with debris and calculi at its end where it opens into the urinary bladder. Now you see that these are adjacent vessels, and the adjacent vessels do not show any significant movement. Now you see that this segment of the vessel is not showing some movement, but anyways, so this is the cause of all the above mentioned pathology.
This side?
मेरी तरफ बस. Now let's see the left kidney, the status of the left kidney. It's normal, and you see the blood supply. All of the parenchyma is being perfused normally. So this is our case of the day. Thank you very much.